how do you take a model that's maybe drawing from some of the psychological sciences in the US or the UK, but how do you adapt that and deliver that in rural India, for instance? So there was very, very close involvement of the local communities, ensuring that, the term depression is not the same in every culture, every context. So even the idea of mental health is not the same in all settings. So I had to think carefully, how do you adapt the content so that it would align with the local understandings of that condition. What's fascinating with, I think, this entire process is that the impact of depression is consistent virtually in every culture, every setting globally. It has devastating impacts on people's functioning, their families, their livelihoods. But the way it's described and the way it's viewed within cultures is very, very different. So I had to think carefully about how to frame the intervention around the local context. And then this was followed by large-scale evaluations. And now we're at a point where there's such rigorous clinical evidence now coming from dozens of countries all around the globe, showing that when you train these providers and support them in a rigorous way, that the outcomes are excellent. I mean, it's on par with the highest level of trained psychologists or psychiatrists delivering the same interventions. So I think when we think of medicine in general or healthcare in general, it's an incredible paradigm shift to think that this is the type of, we can effectively treat mental illness in virtually any setting. And what we're trying to do is then now actually bring that to scale and basically make it work, even in a country like the US.